Welcome to the Learning Center, a place where nurses can learn and discuss the newest and best practices to triage their patients. I am Marcy Line, the TriageLogic nurse educator. Welcome back for another scenario in our course titled Case Studies and Scenarios in Nurse Triage. This scenario should be started after completing our course on the 10 critical steps of a triage call. This course can be found on our Learning Center. Just as with our other case studies on baby Laura, Juan, and Paula, this scenario will focus on how the nurse uses the 10 critical steps to perform a thorough assessment on the patient, how she picks the correct protocol and disposition and gets her patient to the right level of care. Each scenario in this course will focus on a different patient with a different set of symptoms. It is up to you to ask the right questions, pick the right protocol, and find the right disposition for your patient based on the history and assessment that you collect. Before being introduced to your patient, let's do a quick review of the 10 critical steps of a triage call. Step 1. Introduce yourself. Step 2. Collect demographic information. Step 3. Collect a brief past medical history. Step 4. Let the patient talk. Step 5. Document a brief yet complete assessment. Step 6. Choose the right protocol. Step 7. Get your patient to the right level of care. Step 8. Give all relevant care advice. Step 9. Make sure your patient knows when to call back. And Step 10. Offer reassurance and be sure your patient is able and willing to follow the plan you discussed. Let me introduce you to your patient and tell you a little bit about him. Meet Joseph. He's 8 years old. Joseph lives with his parents and 5-year-old sibling and is in the 3rd grade. He was born full term and is a healthy child. His only medication is a multivitamin he takes every morning. His developmental history is normal. He does have an allergy to amoxicillin, which results in an itchy rash. He has no past surgeries or hospitalizations, and it is Joseph's mother that is calling Nurse Triage for advice this evening. I will let you introduce yourself to the caller. This will cover steps 1 and 2 of the 10 critical steps of the triage call. While it sounds awkward to say out loud without a real patient on the phone, practicing your introduction does help you sound more confident and self-assured when you are on the phone with a patient. Joseph's mother, Kendra, sounds exhausted. Now is a good time to empathize with her before verifying demographic information. Words of empathy and comfort are easy for some people, while others tend to stumble and not know what to say. Practice and time will make it easier. You might try something like, "You sound exhausted. This must have been a long week for you." Or, "I'm so sorry Joseph isn't feeling well. You sound as if you all could use a good night's sleep." These statements show your patient you are empathetic, but also in a position that you will help them get to the proper level of care. Starting with an open-ended question is a good way to let Kendra start telling you why she's calling today. What would you say to Kendra at this point? Saying something like, "What prompted you to call me this afternoon?" Or, "Tell me more about Joseph's symptoms," are good ways to start collecting your assessment. Remember to keep it brief yet complete. The parent may tell you a lot of information that is not relevant to the patient's current symptoms. It is up to you as the professional triage nurse to determine what is important and pertinent and focus the caller on those symptoms. Kendra tells you that Joseph started with a mild cough and runny nose about a week ago. The nasal drainage started out as clear, but is now thicker and harder to blow out. His cough is getting worse too. It is more frequent, and he is starting to bring up phlegm. He doesn't sleep well at night due to the cough, which is keeping everyone awake. Even though nothing Kendra is saying right now is sending up red flags that Joseph would need to be seen in an emergency room this evening, you will want to make sure and do a thorough telephone assessment of his current respiratory status. You will rely heavily on Kendra to help you, so you want to make sure she's up to the task. It is important to keep her informed about the respiratory assessment process and why you are asking so many questions. Start by saying something like, "I want to get a better picture of how Joseph is breathing. You will need to be my eyes, and I will be asking you specific questions and having you do specific tasks to determine his respiratory status. Are you okay with this?" Start by having Kendra describe Joseph's skin color. Is he pale? Does he look bluish? Is he flushed? Do his lips look bluish when he coughs? Next, have her watch him breathe. Do his nares flare, or does he seem to be uncomfortable? Very early in the call, you will want to rule out wheezing, grunting, or other audible noisy breathing. Have Kendra put Joseph's mouth up to the phone so you can hear him breathe. Joseph is 8 years old, so you can ask him a question such as, "Will you say your ABCs for me, please?" You should listen for any shortness of breath, audible wheezing, stridor, or grunting. Next, have Kendra lift Joseph's shirt to expose his stomach and rib cage. She must be able to visualize both to determine if he has abdominal or intercostal retractions. You might need to explain what a retraction is and what to look for in order for Kendra to assist you here. How would you talk Kendra through looking for a retraction? How would you describe what one looks like? While Joseph's shirt is raised, have Kendra count his respirations for 1 full minute. You will need to give her a few instructions such as, a full respiratory cycle is when Joseph breathes in and then out. I will be the timer, and I need you to count how many times he completes a full respiratory cycle in 1 minute. Does that make sense? Another way to instruct Kendra is to have her count each time Joseph breathes either in or out, or each time she sees his stomach rise or fall. Along with your protocol, you're going to be using your critical thinking skills and nursing knowledge to properly assess Joseph. Let's reflect on what we know about coughs. We know that a cough is the protective reflex that clears the throat of mucus or irritants. We also know that a cough can be chronic or acute. A cold is the single most common cause of an acute cough. Acute meaning a cough with less than 3 weeks duration. Although it seems Joseph is still in this category, we want to also be thinking of other reasons he could be coughing, such as croup, asthma, allergies, or even whooping cough or choking on a foreign body. We know that while Kendra is concerned about Joseph now bringing up phlegm when he coughs, it does not tell us if the cause is viral or bacterial. Yellow or green sputum can be a normal part of the healing process for viral tracheitis or bronchitis. As a nurse, we should also be mindful that we must protect his airway at all times. With the information you have collected so far, you can now begin to estimate and categorize Joseph's level of respiratory distress. With mild respiratory distress, you may see rapid respiratory rates, mild stridor, or wheezing may be present. Moderate respiratory distress shows labored breathing with some retractions and nasal flaring, stridor and wheezing can be present, and audible during triage. Severe respiratory distress shows marked respiratory effort, struggling to breathe, or even retractions. Cyanosis may occur and breathing may be weak or slow. When collecting your respiratory assessment, it is important to remember that fevers can minimally affect respiratory rate. On average, the respiratory rate rises by only 2 breaths per minute for each degree Fahrenheit above normal, or 4 breaths per minute for each degree Celsius. Now that you have a full respiratory assessment, you are ready to finish step 5. Let's document the who, what, where, when, and why Kendra is calling today. You already know that Joseph's symptoms started about a week ago and consist of nasal drainage and a cough. What other information will you need to determine the best protocol to use to assess his symptoms? Information about Joseph's activity level, fever, overall appearance, and any sick contacts would be important when determining how to proceed. You now have enough information to choose a protocol. Which protocol or protocols would you want to use? Several protocols come to mind quickly: the cold protocol and the cough protocol. We want to always use the protocol that we suspect will give us the highest acuity, that is, the safest for the patient. In this case, the cough protocol would be most appropriate. Step 7 involves getting your patient to the right level of care. We need to ask a few more questions in order to make that determination. What other information would be important to know to help you make a decision on whether your patient should be evaluated in the emergency room tonight or if it is safe to keep him at home? Remembering your ABCs and neuro symptoms are going to help you with step 7. Always rule out airway, breathing, circulation, and neurologic problems first. The most urgent questions, such as, is Joseph having any difficulty breathing or any chest pain? Does he have a bluish face or tongue? Does he seem to be struggling to breathe or unable to speak, were all ruled out during the first minute of the call as you completed your respiratory assessment. Additional information, such as the color of Joseph's sputum, his breath sounds, his respiratory rate, and the presence of fever, ability to swallow, and a quick review of any pertinent past medical history are documented next. Here are the results of your assessment. Joseph is still active and playful. Cyanosis is not present at rest or when coughing. His respiratory rate is 24 minutes at rest. There are no retractions noticed by the mother. You do not hear any wheezing, stridor, or grunting when listening to Joseph, and he can speak in complete sentences. He told you there is no pain when coughing, and his chest does not hurt when he takes a deep breath. He also denies ear and throat pain. His cough is productive with clear, thick sputum. He is eating and drinking about 75% of his normal intake. He is afebrile. Mom states the cough has woke him frequently during the night for the last 2 nights. He does seem slightly more tired today and is content watching TV and playing his video games, but does respond to her when she talks to him and has gotten up several times to urinate and get something to eat and drink. Kendra has not tried any over-the-counter medications yet. She has a humidifier, but she has not used it. Based on this information, you are going to assign Joseph a disposition of home care. Steps 8, 9, and 10 of the triage process are going to take a little longer for this call. Anytime you are keeping a patient home and not sending them to an urgent care or emergency room, you must give specific and detailed home care advice. This is step 8. You must give them specific callback advice. Step 9. And make sure that the caller or patient understands everything you have discussed. This is step 10. How are you going to communicate this to an already exhausted Kendra without adding to her stress level? An example might be, Kendra, I'm glad you called me tonight. It appears that Joseph's symptoms can be managed at home. I will give you some easy-to-follow instructions that will help clear his nasal congestion and should ease his cough some. Hopefully, it is enough so that you both can get some sleep. Keep your advice short and relevant. You should consider having Kendra write it down since she is already tired and may not remember everything. This statement lets Kendra know she did the right thing by calling and will give her a plan of action to follow and instructions on what to watch out for in case Joseph seems to be getting worse. You end the call knowing it may still be a long night for Kendra and Joseph, but they now have some home measures to try this evening. Kendra calls the nurse line the next evening to say thank you to the nurse she spoke with the previous night. She was considering going to the emergency room last night, but decided to call the nurse triage first. Joseph did respond to home care, and they both got a better night's sleep. She is confident now that she has the tools and information needed to manage his cough at home, and also knows when she should call the doctor's office. Another grateful and satisfied patient. Job well done. The Learning Center welcomes any feedback or comments. Please check back soon for more scenarios and great articles.